Hello everyone, welcome to the Lab INFORMANTS. This is a platform that helps you to understand about your medical condition and also the role of laboratory in diagnosis and management of your health condition. It is your presenter, Mr. Eric Masiga, and today we are discussing with you about diabetes. In our today's focus of attention, we will help you understand what is diabetes, what causes diabetes, what is the classification of diabetes, what are the types of diabetes, the signs and symptoms of diabetes, risk factors of diabetes, diagnosis of diabetes, and majorly laboratory diagnosis. We will also help you understand about the prevention and control of diabetes. By definition, according to the WHO, that is World Health Organization, diabetes is defined as a chronic or long-lasting metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads to over time serious damage to the heart, blood vessels, eyes, and nerves. What are the causes of diabetes? Basically, the causes of diabetes depends on the type of diabetes. And there are three types of diabetes, which are type 1 diabetes or juvenile diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes occurs when damage to beta cells in the pancreas means the body can no longer produce enough insulin. And insulin is a hormone that the body needs to manage blood glucose levels, also known as blood sugar. The purpose of insulin in the body. Insulin enables glucose from food to enter the body cells to produce energy. If glucose cannot enter these cells, too much glucose will accumulate in the blood, a symptom known as hyperglycemia. Eventually, it will cause damage throughout the body. Type 1 diabetes usually develops in children, teens, and young adults, but it can also happen at any age. However, a type 2 diabetes is a progressive condition where the body becomes resistant to the normal effects of insulin or gradually loses the ability to produce insulin in the pancreas. It is associated with lifestyle risk factors and is managed with lifestyle changes such as diet and exercise, as well as medication and insulin injections. People with type 2 diabetes are said to be insulin resistant. Gestational diabetes. Gestational diabetes happens when the mother is diagnosed with diabetes for the first time while pregnant. And during pregnancy, the body produces a large amount of certain hormones to help maintain a healthy pregnancy and provide nutrients to the baby. This increase in hormones can interfere with insulin, a substance which takes in sugar or glucose out of the bloodstream and uses it for energy. This causes a higher blood sugar levels, which is normal in pregnancy because the extra glucose is needed to support the baby. But when the amount of insulin produced is less than what is needed to handle the blood sugar levels, it can lead to a higher level of glucose in the bloodstream. This is also known as hyperglycemia, and gestational diabetes can occur. What are the symptoms of diabetes? Symptoms of diabetes can include increased thirst or urination, increased hunger, feeling fatigue, having a blurred vision, numbness or tingling in the feet or hands, having sores that do not heal, and but not limited to unexplained weight loss. What are diabetes risk factors? With type 1 diabetes, a family history, that is, having a parent, a brother, or a sister with type 1 diabetes can be a risk factor. As well, age. You can get type 1 diabetes at any age, but it usually develops in children, teens, or young adults. The following are risk factors for type 2 diabetes. And remember, as I said before, type 2 diabetes is usually associated with the lifestyle changes. Therefore, being overweight or obese, having an age of 45 years or older, having a family history of diabetes, having a high blood pressure, a low level of HDL, which is good cholesterol, or a high level of triglycerides, having a history of gestational diabetes, which is diabetes in pregnancy, or if you have ever given birth to a baby weighing 9 pounds or more, if you are not physically active, having a history of heart disease or stroke, having depression, if you have ever had a polycystic ovary syndrome, or having a dark, thick, and velvety skin around your neck or armpits, a condition known as acanthosis nigricans, are risk factors of type 2 diabetes. Diagnosis of diabetes. When it comes to diagnosing diabetes, and here majorly laboratory diagnosis, the following tests can be conducted in order to predetermine if you have diabetes or if your blood sugar levels are high. These tests include a random blood sugar test, a fasting glucose, a 2 hours postprandial glucose, a 75 grams oral glucose tolerance test, which is mostly done in pregnant women, a 50-gram osovilian test, an insulin test levels, HbA1c test, which is used to diagnose or confirm if you have diabetes. It can also be done as a follow-up test to show how well you are responding to your diabetes treatment. A doctor can also order a urine microalbumin, which can help to evaluate if you possibly could be having a kidney failure or if you are at risk to have a kidney failure in future. A C-peptide and a lipid profile, which shows cholesterol levels and triglycerides. What are the prevention and control measures of diabetes? Basically, eating healthy, doing a physical activity, having regular health checkups. If you are smoking, you need to quit smoking. Screening for early signs of diabetes-related kidney disease and treatment, and also checking your blood lipid to help regulate cholesterol levels are considered stunning prevention and control measures of diabetes. Thank you for watching. Please subscribe, like, and share with your friends and family to help them stay informed and on top of their health.